Everyone, you probably already know that diabetes can be super tough to deal with if you do and take good care of yourself. But here's the thing, you might not even realize that some little mistakes you make every day could turn into big problems down the road. We're talking serious stuff like heart attacks, vision loss, and even kidney failure. Yikes! So if you're living with diabetes, it is time to take a good look at what you're redoing and see if you're remaking any of these common mistakes. Let's dive in. Mistake no. 1. Skipping out on blood sugar monitoring. Okay, we'll cut right to the chase. If you're not checking your blood sugar often enough, you're making a big mistake. Checking your blood sugar helps you understand how your body is handling glucose. It gives you the info you need to make smart choices and avoid potential problems. Some folks might think that checking their blood sugar once in a while is enough, but we're here to tell you that regular monitoring is key. Whether you're using a device to test your blood sugar or checking it with your phone, make sure you're doing it often enough. Not keeping tabs on your blood sugar levels is like trying to drive without a map. You're in for a bumpy ride and you might miss out on some beautiful views along the way. And remember, it's not just about the numbers. It's about staying informed and in control of your health. By monitoring your blood sugar, you can catch any issues early and make changes before they become bigger problems. Don't skip out on this important step. Your body will thank you for it. Mistake no. 2. Not taking your medication right. Now let's talk about medications for diabetes, including insulin. We get it. Taking shots or using an insulin pump isn't exactly the most exciting part of living with diabetes. But here's the thing, skipping doses or not taking your medication as prescribed can lead to some serious side effects. When you don't take your insulin or medication as your healthcare team has recommended, your blood sugar levels can go haywire. And we're not talking about a little blip. We're talking about highs and lows that can land you in the emergency room. Not taking your medication as directed is kind of like forgetting to pay your bills. You might get away with it for a while, but eventually the consequences catch up with you. Stay on top of your medication routine and keep those blood sugar levels in check. Mistake no. 3. Eating like there's no tomorrow. Let's be honest, food is amazing. It tastes great, brings back childhood memories, and makes us feel good, especially when we're feeling low. But when it comes to managing diabetes, keeping a close eye on what you eat is essential. We're talking about being mindful of the foods you choose to put into your body. If you're constantly chowing down on sugary snacks, fast food, or other processed foods, you're making it harder to control your blood sugar levels. Think of your body like a car. To run smoothly, it needs the right fuel. When you eat tons of sugary foods, it's like pouring the wrong type of fuel into your car. It might work for a bit, but eventually you'll start experiencing some serious problems. On the other hand, if you eat a balanced diet full of whole grains, lean proteins, and healthy fats, it's like giving your body the premium fuel it needs to run at its best. So before you dig into that bag of sweets, ask yourself if it's really worth derailing your blood sugar levels. Remember, you have the power to make healthier choices and take charge of your health. Mistake number 4. Not getting active enough. Okay, we all know exercise is important, but if you're living with diabetes and not staying active, you're making a huge mistake. Exercise isn't just about looking good. It's about feeling good and keeping your body running smoothly. When you sweat it out, your muscles use up the extra sugar in your bloodstream, which helps lower your blood sugar levels. Plus, being active helps your body use insulin more efficiently, which is like a superhero power when you're dealing with diabetes. Sitting around all day can make your body's insulin control system go out the window. Staying active helps keep that system in check. But remember, we're not talking about training for the Olympics here. Even a daily walk can make a world of difference. If you're currently inactive, start slow, set realistic goals, and work your way up. Before you know it, you'll be feeling healthier and more energetic than ever before. Mistake number 5, ignoring stress. Life is stressful. We get it. Work, relationships, finances, and family can all add up and leave you feeling frazzled. But here's the thing, if you're not taking steps to manage that stress, you're making a huge mistake. High stress levels can wreak havoc on your body, and that includes your blood sugar levels. We're talking about elevated stress hormones that can make your blood sugar go haywire. When you're stressed, your body releases hormones like cortisol and adrenaline, which can raise your blood sugar levels. This might not be a problem if you're only stressed occasionally, but chronic stress can definitely take a toll on your health. So what can you do about it? Well, finding healthy ways to manage stress is key. Whether it's yoga, meditation, deep breathing exercises, or simply taking some time to relax and recharge, it's important to find what works for you. By taking steps to manage your stress, you'll not only be helping your mental well-being, but also keeping those blood sugar levels in check. So if you're making any of these mistakes, it's time to take action. Managing diabetes is a team effort, and you deserve to be your own health hero. Start by checking your blood sugar regularly, taking your meds as prescribed, eating nutritious foods, and staying active. Oh, and don't forget to tackle that stress head-on. Remember, knowledge is power. The more you understand about diabetes and how to manage it, the better equipped you'll be to make informed decisions and take care of yourself. Don't let diabetes hold you back. Be proactive, stay positive, and keep crushing those goals. You got this. Have you ever wondered why, after all these years of advancement in the field of medicine, being sick or having a medical condition is such an expensive affair? You've probably heard stories about how people with medical conditions face overwhelming financial burdens when it comes to treatment or struggle with accessing healthcare services, even in developed countries. The reality is, healthcare costs and access to medical services have become some of the biggest challenges facing both patients and healthcare systems today. But why has this issue become so urgent? Well, here are 4 reasons why millions of people still can't afford medical treatment. Number 1. Healthcare costs, a financial burden. In many countries, especially in the US, the cost of treating chronic or serious diseases like cancer, diabetes, heart disease, and others can skyrocket to thousands of dollars per month. This creates a difficult choice for many people: continue treatment or go bankrupt. While healthcare insurance is available, it often doesn't cover the full cost, forcing patients to pay a large portion of medications, tests, and long-term care out of pocket. The differences between insurance plans and people's ability to pay leave many patients with no choice but to delay treatment or forego necessary care. A recent study showed that more than 40% of Americans had to cut back on other expenses just to afford their medical treatment. Can a civilized society accept the fact that only a few people can afford life-saving treatments? No. 2. Access to healthcare services, a challenge for many. Alongside the high costs, access to healthcare services remains a massive issue. Long wait times and doctor shortages are factors that prevent many from getting the care they need in time, which can lead to misdiagnosis or untreated complications. This issue is even worse in rural areas or countries with underfunded healthcare systems. Despite modern advancements in healthcare, doctor shortages, a lack of resources, and overcrowded hospitals and clinics still make it difficult for patients to receive care on time. This doesn't only affect patients, it also puts healthcare professionals under tremendous pressure, impacting the quality of care provided. 3. Inequality in access to healthcare services. Another significant problem is the inequality in healthcare access. People living in remote areas or from minority groups often face language barriers and transportation difficulties, making it even harder for them to access quality healthcare. They also have to deal with a shortage of specialists and limited medical facilities in their regions. Additionally, there are income disparities and gender biases that prevent certain populations from receiving adequate care. Low-income individuals, workers, and women, in particular, are often discriminated against, denied proper care, or unable to afford the services they need. This creates a gap in the system that leaves many people without the medical attention they deserve. Number 4, solutions to address healthcare costs and access. So, how do we ease the burden of treatment costs and improve access to healthcare services? One crucial step is to foster greater collaboration between governments, healthcare organizations, and communities to build a more sustainable, efficient, and equitable healthcare system. Governments must invest in public health infrastructure, training, and education. By doing so, they can ensure that everyone has access to quality healthcare regardless of their background or financial status. This includes expanding universal healthcare coverage, lowering the cost of medications, and ensuring that patients have easier access to affordable drugs. It is also essential to address the root causes of health disparities and remove any barriers that prevent certain populations from seeking medical care. By taking these steps, we can create a healthcare system that works for everyone, improving the health and well-being of our communities and ensuring that no one faces the impossible choice between their health and their financial security. The rising cost of treatment and difficulties in accessing healthcare services are not just issues for poorer countries or those living in remote areas, they are global challenges. Millions of people worldwide struggle to access the medical care they need, leading to preventable illnesses, complications, and even deaths. Without effective solutions, this issue will continue to hurt the health and well-being of millions of people worldwide. We need a fairer and more efficient healthcare system, one where everyone has access to quality care without the constant worrying of financial hardship. The good news is that we already have the knowledge and tools to create positive change. By working together, we can ensure that healthcare is a right, not a privilege. What are your thoughts on this issue? Do you think the government should provide free healthcare for all citizens, or do you think that would be too expensive and inefficient? Let us know your thoughts in the comments section below. And if you enjoyed this video and want to support our channel, be sure to like and subscribe so you never miss an upload. Thanks for watching.